Well, good afternoon and welcome to the Flint Community Webinar on Coronavirus. We are now in week 97. And for those of you that joined us over these 97 weeks, we certainly appreciate your faithfulness and diligence to help us share information that will be brought to you today by the Healthy Flint Research Coordinating Center, the Flint Center for Health Equity Solutions, and the Michigan Prevention Research Center. It is our delight that you have joined us, and we hope to continue to provide for you relevant information that you can share with our community members. We look forward to this opportunity. I'm extremely pleased today to be your moderator. My name is Yvonne Lewis. And sometimes I forget to tell you what my name is because I've said it so often, but I thank you for joining us as the co-director of the Healthy Flint Research Coordinating Center. Our goal is, with all of our partners, to ensure that we're bringing you quality information, as this webinar is designed to bring a local context to a global pandemic. And yet we know it isn't the only thing that's going on. COVID isn't the only issue we have. There are other relevant issues that we'll bring to you. And so again, our partners who join us every week for this conversation, they are here today, many of them on the call today to answer questions for you, such as Hurley Medical Center. We're happy to have Nurse T with us today. We have representatives from the city, and also we have I'll call him our local and resident pediatrician, Dr. Lawrence Reynolds, who's sharing information with us. We have representatives from the Genesee Health System, Greater Flint Health Coalition. We also have Jim Melanowski from the Genesee Health Plan, and Katie Baxter, going back, Katie Baxter is with us from Genesee Health System. I'm sharing this with you today because we want you to be sure to put your questions in the Q&A for us today, because our participants are here, our panelists are here to answer questions for you that we may not get to as we have our discussions in the roundtable and present our other presenters. The Genesee County Health Department is here, ready to answer questions for you. University of Michigan Flint, Michigan State University is also here to answer questions for you. So again, we're asking you put those questions in, and we'll do our best to get to them today. We have an amazing session for you today. I really want our community to understand we're a little bit ahead of the curve, and we'll bring that out today. We're going to talk some more about isolation and the quarantine recommendations. Many of you have had questions about that because it isn't always clear. And so we want to answer those questions as best we can. We're going to talk again about signs and symptoms to get those questions answered. There have been some changes since we started this webinar 97 weeks ago, and yet we're still answering some of the same questions. We'll have a medical moment from Dr. Susan Wolford talking about obesity and COVID and extension of that. And of course, we'll give you some updates from the health department as well as the city of Flint. So this afternoon, I'd like to invite our panel to help me tease out this first part of our conversation today. Dr. Reynolds, Dr. Deborah Verholden, Dr. Wolford, and I do see a representative from the health department, Kaylee, is on the line with us. And Nurse T, you might also want to chime in a little bit here for us today. I want to start off a conversation. Dr. Deborah, we didn't have an opportunity to talk about this, but you've been on national television. You've been on our local radio station, our local radio, TV, and Facebook talking about some of these issues. I listened yesterday to a news clip, and they were talking about now COVID-19 being an endemic. And a few weeks ago, we were actually talking about this when you explained to us the difference between the pandemic, the epidemic, and then the endemic. And I do want to know if you can just come on and help us get started with that conversation this morning. And Dr. Reynolds, as she's preparing to come on, Doctor, let's you and I have a little bit of a chat here, because you've also mentioned to us so many times about the things that we need to do to protect ourselves. Vaccination is the foundation. I think that's your phrase. And if you can just give us a little bit of that insight as we're opening up this roundtable.
Oh, yes. I think we're going to have to start posting our graphic at the beginning of every broadcast of the Swiss cheese model. And I bring it up because, you know, a pack of Swiss cheese has holes in each slice, right?
Right.
But each slice, if you put them together, provide a significant increase in protection. And so you can't do just one thing. Yes, and vaccination is the foundation for the prevention of infection. Now I have to modify that and say it's the foundation to prevent a complication like hospitalization and death. It's effective also in preventing infection, but now because of Omicron, we have to wear our masks because we don't want to spread if we are infected. We may have a lower viral load, but we don't want to spread it to someone else, nor do we want to take in more that will increase our viral load and chance of infection. So I said vaccination, I talked about masks, and you've heard the conversation change about masks. Now they're talking about the N95 mask. They're definitely recommending not wearing a cloth mask by itself. Now, a surgical mask under the cloth mask is good if that's the best you can do. And believe me, it's a challenge to find an N95 that will fit a child. And it might be a challenge for some of us with small faces. I have a big head, so I'm at the other end of the problem. But what I have done lately is when I go out and I have to sit in a crowd, uh, I will put on an N95 mask. And believe me, I don't sit in a crowd voluntarily. I do it because I'm ordered to do so by law for some meetings. So those are layers of protection. You wash your hands. So carry some hand cleaner with you in case you find yourself in a situation where there's nothing around. Now, I've told you in the past, my barber logs in his patients, I'm sorry, his clients, and has them uh, leave their latest telephone number so that if there's any contact situation, he can call you. And he only schedules one person at a time. And sometimes someone arrives early or he gets behind, but there's no more than 2 customers in there at a time. That makes a whole lot of sense, doesn't it?
It does.
However,
Attract people, right?
yes. However, we look around in our community and there are various organizations, schools, some churches, some funeral homes who are actually not doing this. So, another layer of protection is your brain. You have to walk in and assess a situation because the other level is physical distancing. I don't say social distancing, physical distancing. And that means you maintain that 6-foot distance. You don't stay there longer than you have to. And if it's too crowded, you get out. And there's no shame in my game for leaving a situation.
So, Dr. Reynolds, as you're right there in this conversation about these layers of protection, we also recognize, and you mentioned a little shift there when you talked about the vaccinations, because early on in this conversation, the idea about vaccination was to prevent getting COVID. Now we've learned, obviously, because of experience, vaccines won't prevent it, but it
Let's
reduces.
say won't prevent it 100%. Let's be clear on that.
Right. Because
Nothing is 100%.
because that's a real concern for our community when we've already heard this message that that's why we should get vaccinated. And we now see people who have been vaccinated, have been boosted, are also getting COVID. So these other layer protections are equally important.
And we should be quick to add the majority of the people in the hospital, in the ICU, on vents, or who have died were unvaccinated or not completely vaccinated. We need to be clear on that.
Yeah. So, Nurse T, you might have some insights for us on this because you worked at Hurley Medical Center and actually before and out on the road, ready to help us out here. And so you've been in conversations with community members about this whole issue of vaccinations or non-vaccinations, wearing masks or not wearing masks. So from that hospital perspective, give us some real clear insights from your experience.
From my experience, it's very crucial to follow all of the recommendations. Especially now, even patients coming into the medical center, we're asking them that when they come into the medical center that they wear masks. And even being inpatient, we're asking our patients to wear a mask. The only time a mask is not being worn is if there's an adverse effect or there's some reasons to why they can't wear a mask. I know a lot of the community members are saying that it didn't stop my mom or my dad or my aunt or my friend or anybody else from getting COVID and they died from it. But the one thing that a lot of the community members don't understand is that a lot of the patients that are passing from COVID, they all have underlying conditions. They have diabetes, heart failures, kidney disease, asthma. They have a lot of medical conditions that are not in control. And what I'm saying as far as not in control, when COVID hits, it hits you. And what I like to say is like a thief in the night. It comes and it hit the most vulnerable part of your body. So if you're diabetic and you're non-compliant with your diabetes or you're not actually taking care of yourself, guess what? COVID hits you and it's like, okay, guess what I'm gonna do? I'm gonna hit them and now they're gonna be fatigued. They're not gonna be eating right. Then the next thing you know, oh, okay, I got that. So now I'm going to take out their respiratory system. So I'm just really encouraging the community to be mindful. And I always say that activation starts with you. And so right now, activation, prevention, protection, it has to start with the individual. The individual has to really now value their life and others more than ever because it's so many different variances and it's so many different things that we're doing. And as soon as we come up with one treatment, it does something else. So if I could stress anything as far as the hospital, just please, 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 please take COVID serious, value your life, the community, and everything that's going on, and know that the hospitals are working extremely hard to be able to provide service. But we need participation from the community too.
Thank you, Nurse T. And one other thing is you were talking about that we know that our hospitals now are full with patients, and many of them who are in the emergency rooms really need to be in a hospital bed, but they're not beds sufficient enough now for them. So it's really important because the other issues you mentioned, they're not going away. So it's important for us to take care of those other issues. So we still want people, if they're in an emergent situation, to get to the medical center.
Absolutely. I mean, if you're having any of the signs and symptoms, please come to the medical center. I mean, you can go to the urgent care, you can call your primary care physician, you can come to the emergency department. But the one thing that I will say is do not get discouraged. Right now, every hospital, as far as, that I could probably speak on just from hearing the numbers, they're in double digits. We're in double digits with inpatient. On the average, we got 20 to 30 patients in the ED waiting to be seen. And the most of the patients that we're seeing, they're not vaccinated.
Okay.
They're not vaccinated.
That gets back to some of the things Dr. Reynolds said. If you're not vaccinated, you still need to follow these precautionary measures, but it is a consideration. It is a consideration. We're not trying to demonize anybody or say anybody is a bad person because they're making a decision. But what we do want you to do is make an informed decision. Be sure you've gotten all your questions answered. And one of the big questions is about quarantine and isolation. And Kaylee, you're working at the health department, and I hope you can help us with some of these questions that our participants have, because we do understand that it's different now. The recommendations are changing. We went from 14 days and now we're talking about 5 days. Can you clarify this for us so we can make a better decision?
Absolutely. The guidance I know can be tough to keep up with. It does change, especially when these new variants come out. The biggest change recently has been to that 5-day quarantine and isolation. But as we know, and, Dr. Reynolds can speak to this as well, when we're talking about that 5-day quarantine and isolation, that's the majority of people. So we know that with the Omicron variant, about 70% of people are not going to be contagious after that 5 days. However, there are still going to be some of those folks after that 5 days who are coming down from that infectiousness. So their infectivity is going to be lower every day, but they're still going to be potentially contagious on day 6 or day 7, which goes back to what Dr. Reynolds was talking about before, is those layered prevention strategies. So we want to be able to get kids back to school sooner. We want to be able to get people back to work sooner, but it's imperative in order to do that to make sure that we have multiple mitigation measures in place. So when you're going back to school on day 5, making sure you're wearing that mask. When you're going back to work on day 6, make sure that you're wearing that mask. So we can, with the Omicron variant, there is less time that people have to stay home. You can get back to your activities quicker, but you still have to make sure that you're taking into consideration that even though most people aren't going to be infectious, there's that 30% of people that could be. So making sure that you're wearing the masks, making sure that they're tightly fitted, and making sure that for those additional 5 days until you get to 10 days outside of your infection, make sure that you're making the best decisions you can. If you can wait another weekend to go see grandma with kidney issues, wait another weekend to go see grandma with kidney issues. If it can't wait and grandma needs food or grandma needs groceries, get those groceries, and as long as grandma can safely walk through to the door, leave them there for her and come visit her the next weekend. So making sure that we're making the best choices available to us with the information that we have.
Now, Kaylee, we're talking about Omicron, but is Delta still around, or are we just not even going to talk about Delta anymore?
Delta is still around in the periphery. Right now in Michigan, we know that about 90 to 95%, closer to 95% of the cases we're seeing are Omicron variant cases. So we know that Omicron is overwhelmingly present in the community. We are still seeing a sprinkling of Delta, though we expect that the amount of Delta cases will continue to decrease, and Omicron is going to be probably the only thing that we're seeing in the near future, probably within the next week to 2 weeks.
So it's important now. This epidemiology is not my world right now, so I need to really rely on you for this, and those who are really studying this. But as we understand it, it may not be. There may be another variant. So it isn't just that we ought to be satisfied or comfortable with where we are. We still need to be diligent.
Right. And that's incredibly important, because we know the more we learn about these variants and the more we learn about the lineage of these variants, we know that all of these variants didn't necessarily come directly from each other. So for example, the Delta variant is not what spurned the Omicron variant. So it's not that we take a variant and then the next variant is just a little bit different than that last variant that we had. These variants are not all necessarily derived from each other, which means that these variants can behave very differently. So as we move forward and as we move to, like you were speaking to earlier, where we move towards this idea of COVID endemicity, we need to make sure, like Dr. Reynolds said earlier, that we think about all those tools that we have at our disposal. We think about utilizing masks. We think about the ability to, if we're sick, stay away from other individuals, to make sure that we use all of the strategies available to us to make sure that we can combat the variant that we're dealing with most appropriately, but also keep children in school, keep people at work, be able to see our families, and be able to do the things that we want to do as safely as we can do those things.
Now, Kelly, thank you, Kelly. I'm gonna do a quick rewind because you did a new word on us here. I said endemic, you said endemicity.
It's just, Yvonne, I love you to death. It's just a derivative of the same thing. So endemic, it's the same term, I promise, but endemicity is just when you get to a state of being endemic. So that means that we know that this is here. We know that it's here to stay. So we're very used to, in the wintertime, we know that flu season comes and goes every year. There are people who, we go out, we get our flu vaccine. In other countries for years, it's been a practice that during flu season that people wear masks to protect themselves on public transportation. So taking the information that we have about COVID-19 and finding a way that we can work that into our routine to make sure that we can do the things that we need to do, accomplish the things that we need to accomplish, but take appropriate precautions to try and protect our health and the health of others.
Yeah, so Katie, this is really important because these terms change so often. And we started off with this big scare 20 months, 21 months ago, well, almost 24 months ago. And sometimes in the course of the conversation, it shifts and we really kind of get a little tone deaf because it's frustrating and we don't have an answer. We really just want to encourage everybody. And I think Dr. Deborah May and Dr. Lawrence may come back, Reynolds may come back on a minute, but I really would like, and I haven't asked you guys this, so bear with me on this one. Just help us to really get a sense of how important it is, even though we don't have all the answers, to really try to follow as closely as we can so we can make good decisions. And when we hear these terms, don't be afraid to ask, clarify for us what it is we're actually talking about. So we went, again, we went from pandemic, which means this is all over the world now. We're having the COVID. And now we're saying endemic, which means it's going to probably be here for a while. And some will say it'll be here for the rest of our lives. But that doesn't mean we need to get comfortable now and say, okay, hats off, let's go. And I heard a lady say the other day, let me get COVID. Is that a good mindset? I mean, how do we think about this?
Yeah, I think there's a lot of, mentality that, oh, I'm relatively young, I'm healthy, I should fare pretty well. Even in those situations, COVID-19, and Dr. Reynolds can speak to this from a medical standpoint, but, COVID-19 has been shown to cause a lot of inflammation, not necessarily just in the heart in general. We've seen that in a lot of patients. We see that with MIS-C, specifically in kids. But just because you're relatively young and healthy doesn't mean you can't experience some of these long COVID symptoms. Lingering trouble breathing, lingering inflammatory issues. Some people report extremely lingering issues with their taste and smell, to a point where their taste and smell is significantly altered for months at a time, similar to what you would see after a concussion, where you have those issues for 8, 9, 10 months approaching a year. So it's very important to keep in mind that while your illness might be mild, and that's absolutely true, the consequences of that illness down the road are things that you wouldn't necessarily expect. So taking those precautions that you can take, I know there's some meetings I have to be in, again, by law, with Dr. Reynolds, all wearing masks. So I love that I can come on here and see Dr. Reynolds' smiling face. But I appreciate that, when him and I are in those meetings, I wear my mask to protect Dr. Reynolds. Dr. Reynolds wears his mask to protect me. And that's, the mentality that when we're together in those situations, we operate on. We're trying to protect ourselves, but we're also trying to make sure that we're protecting each other.
Okay. Dr. Reynolds, I see you nodding, and then we're going to hear the last word in this segment from Dr. Deborah.
Oh, yes. And everybody likes to talk about Omicron. Delta is not done with us. And when you are sick, the immediate distinction is not the most important thing. You must have those layers of protection. You must seek appropriate care in conjunction with your provider. But the other issue is it's just Delta may not be gone entirely. So we still need vaccination. And the last thing is, we must remain humble. We try to be careful when we give information, because science is not a belief system. It's supposed to be a process, how we examine things and make decisions. And as you've alluded to, we may, based on the best knowledge that we have at this time, say one thing, and it may change. And I think the most annoying changes are those slight changes, because people will always ask, well, why did you say that then? And why are you saying that now? And that's because we have learned more, and we've learned about things that are more effective. And we'll talk about those tablets. I hope we'll talk about it again, the antiviral medications, because it's becoming Omicron, they are not as effective. So don't say, I don't need vaccination. I don't need these layers of protection because I can go get the pill or I can go get the infusion. No, because it may not be available for you.
I do raise something else because I was in a really interesting conversation the other day that made me a little bit nervous. So we'll have to spend some more time on that, we're calling them treatments and so forth, because that's a really important conversation. So hold that thought, Dr. Reynolds. Dr. Deborah, we're talking what we were ahead of the curve a few weeks ago when we started talking about endemic, and now it's national news, endemic. So I'm gonna
I talk about this stuff on the radio every day. I've been saying this is endemic for well over a year, right? That it would become endemic. Dr. Fauci just laid out these 5 stages of a pandemic. And so I guess now that he said it, maybe more people will get the idea, because I keep telling people that whatever big bang you think is going to be the end of this pandemic ain't coming. There will be no parade celebration. There won't be a flyover. There won't be some magic number we get to when we declare that it's over. That's not what it's going to look like. What it's going to look like is once we can figure out how to reliably and consistently integrate and implement the basic prevention practices that we know help to mitigate negative outcomes, then we'll just gradually get back to life as normal, have a lot fewer people getting sick and a lot fewer people dying. It won't be such a big tax on the healthcare system. And then we'll we'll just quietly sort of be out of the pandemic. That's what that's gonna look like. And that means people are gonna have to get vaccinated every year. They're gonna have to get boosters potentially. They're gonna have to mask potentially during peak seasons or surges. They're gonna have to be really vigilant about their hand hygiene and these other things. And when we reliably, consistently do that, then we'll just sort of see a just smoothing out of this pandemic. But that's all that's going to look like. So this is now, it's now just with us, and that's what that means.
So we just now need to be really, really careful and thoughtful about how we move through this next, and maybe a couple years. When I heard him say they're working on this vaccine 2-3 years out, we'll see where it goes. Because there was a question in the queue about vaccinations, and we'll get to that later. But we do want to just make sure we're paying attention. One of the things we can do now, Sherelle Brown is here with us from the health department, but one of the things we can do now, and thank you so much, panel, is follow the opportunities that we have to get tested and to get vaccinated should you choose to do so. So Sherelle, thank you for being here with us, and give us an update on what's happening with the support of the health department.
Good afternoon. My slides look a little different. But anyway, good afternoon, everybody. This here slide today shows vaccination rates by age group. And I wanted to point out on this slide that the least amount of people who are getting their vaccines are our children at this time and our adults who are 20 to 29, which is the parent of the children. So that group has a direct correlation, to our children. And I want to make sure that people my age and older, 20 through 29, 30 through 39, we have to be proactive in our care. We have to be proactive in protecting our children. And we have to make sure that we get our vaccines and follow the guidelines that are being given to us. I agree with everyone who presented before me. It's not gonna happen unless we get vaccinated, wear our masks, social distance, and be mindful of others. And with that being said, everyone's eligible 5 and up for a vaccine. And if you are 12 and up at this time, you are eligible for a booster, and your eligibility is about 5 months after you receive your first 2 doses of medication, first 2 doses of the vaccine. And then if you're 5 and older now, you also are eligible for the 3rd dose of the vaccine. And that's for our immunocompromised individuals 5 and up. It gives them the ability to get their immunity up, and then also provides them with extra protection because they are eligible 5 months after that 3rd dose to receive their booster. Next slide, please. So please take that into consideration. And I ask you to, if you have not gotten your vaccine, to visit the clinics that are implemented in the community for you. Tuesday, January 25th, we will be at Our Lady of Guadalupe from 12 to 2 p.m. Wednesday, we'll be at Central Church of Nazarene from 10 to 12. And Thursday, we'll be at Shiloh Missionary Baptist Church from 3 to 6 p.m. The children can come and get their vaccines. We want to see our immunocompromised coming to get their 3rd dose if they haven't already. And then we want anyone who has not received their vaccine to just come and comply so that we can get over it. Next slide. And not only is vaccination important, it's also important to get those tests. As we have seen, COVID has hit 1 out of 5 in our community. So we have to be cognizant of that and get tested often. And so every week we provide you with these sites: Word of Life Church, Bethel United Methodist Church, Macedonia Baptist Church, as well as the local Walgreens and Rite Aid and Hamilton Community Health Network. You have many places to go to get a test and many places to go to get your vaccine. And those who are homebound, we're here, we're available, and we want you to call us 810-344-4800 so that we can help make sure that you're protected too.
So Sherelle, while we're at this point, one of the important things that we want to point out is we're talking about the testing sites. When they go to those testing sites, they can get both the PCR, which is the longer term. It takes a little bit longer to get the results back, but they can also get the antigen, which is that rapid test. They can get both those at each of these sites. Is that correct?
That is correct. And they can also get a vaccine there.
Okay. So we want to encourage you, and the more often you get the testing, and Dr. Reynolds has spoken about this just before. He called it cadence testing. So we have to try to get him to clarify that for us. But set a time that you regularly go, especially if you're out and about. Regularly go to get those vaccines, get your testing done, so you exactly have a better sense of what your status is. So thank you so much, Sherelle. We appreciate you sharing this information with us each week. One of the other things that we have talked about before, and it was alluded to a little bit earlier when Kaylee was talking, is that our bodies are all different. And sometimes the way the virus affects us is based upon our own particular body type and what's happening with our bodies. And Dr. Susan Wolford has done an amazing job giving us examples of how the virus affects us individually and collectively. So Dr. Wolford, we're ready for that medical moment today.
Thank you so much, Yvonne. Thank you for this opportunity to share the second part of our little section on the way in which adiposity, the way in which our fat cells, there we go. The way in which our fat cells are able to impact our ability to fight COVID. And so, as you recall, we're calling this medical moment, or this topic, adiposity and immunity, because we don't actually like the word fat. And so we're just using adiposity because that's what we're going to call those cells. And as you will recall, this is what that cell looks like. And we talked about the fact that these cells, these adipose cells, like all other cells in our bodies, are factories that have a job to do. But adipose cells really have a lot of different jobs, and two important ones. One is controlling energy, which we know that it does. And then the other thing is, interestingly enough, controlling our immunity. And one of the ways that it does these two functions is by producing something called leptin. And leptin is a key hormone in our body. And what it does is that it communicates. So there's a communication between our adipose cells and our brain. And part of that communication occurs by this leptin that those cells produce and that go and connect with our the hypothalamus. And it helps to tell the body that, you know what, I have enough food, we're all set, you can stop eating now. But so we like having that around, right? Our brain needs to hear that signal so that we can stop eating. Now, there are lots and lots of interesting genetic problems with that along the way, but we're just going to stick to the main thing here, which is that if we have excess weight and excess energy around, we have a constantly high level of this leptin. So much so that, in effect, the brain is like, wow, that is too much signal, too much noise from this leptin. And it starts blocking it out, like putting on earmuffs. It can no longer hear the leptin as well. So it can no longer hear the fact that you're full. And so it's kind of harder actually to stop eating when that happens. And so then what does the body do? Because you're still eating. And so then it puts out even more leptin. So the question is, why is it so bad to have so much leptin around? Well, one, it's not doing its job, right? It's not telling us that we're full so that we know how to, it's easier for us to stop. But the other really bad thing about all this leptin being around is that leptin is one of those hormones that fires up our immune system to that chronic inflammation, that chronic problem, so that when we get COVID, then we are more likely to have that overreaction to the virus, which then damages our organs, ends us in the ICU, and ultimately having very bad outcomes. So of course, the question you're all asking yourselves now is, if you can spotlight me, is how do we stop our brains from having these earmuffs on, and how do we get them to be more receptive to that leptin so our body doesn't have to make so much of it, so we can keep that inflammation down and we'll be able to respond more appropriately to COVID when we get it. So the ways in which there are 3 Fs. I've heard a lot of alliteration, I think, from Dr. Deborah and from Dr. Reynolds. So we're going to go with 3 Fs that help you keep that, keep those earmuffs off and let the brain actually hear the leptin, so we don't have to have as much around. The first one is fiber. So, I love things from the kitchen, but fiber, you can do it in fruits, you can do it in beans, you can do it in vegetables. Vegetables are actually the best one. So you want to increase your fiber intake because that will allow your brain to stop that resistance to the leptin and allow you to get that signal through. The second thing is fitness. Here's my little skipping rope, fitness. And so the more activity that you can do to be fit, the better the brain is at hearing those signals. And finally, the final thing is sleep. Would you believe it? It's actually sleep. So the F there is avoiding fatigue. So we want to be get enough fiber, we want to increase our fitness, and we want to avoid fatigue, because fatigue stops the brain from hearing that leptin easily. And so we have that leptin resistance. And so one of the ways to avoid that is to avoid fatigue by getting enough sleep. So there we have it. Try those 3 Fs, and hopefully that will help us to decrease one of those things that makes the outcomes of COVID worse. And in fact, any infection would make it worse.
But I like the way you make this comfortable, because you didn't want to say fat and you didn't want to say exercise. So you said activity. So we're gonna do our best to keep those things in mind. We want to get some more fiber. We want to get fit. And we want to reduce our fatigue by getting sleep. Now we got to work on the sleep part. But thank you so much, Dr. Wolford, for that medical moment. And I hope that we're all going to take advantage of these ideas that she shared with us today. Let's move now into looking at our health equity conversation. And Dr. Deborah, we're going to ask you to come back again. Because there's a lot wrapped up in this. We talk, how do we get to that equity and how do we understand it? And that is a lot in understanding the numbers and how the data is provided for us. So Dr. Deborah.
Great. So we got the data this week. I don't know if people realize that and I had a couple people reach out to me. This data comes from the state, and the state did not update the data on Monday. It was Reverend Dr. Martin Luther King Jr. Day, and they were off. So that data got updated. They regularly update that data. If people care, you want to look at the Michigan COVID data dashboard. They update that data every Monday, Wednesday, and Friday. So this week, the data got updated on Wednesday, which means we have more information than we would normally have about things that have happened in the past that we can go back and update. So you'll see we got this big increase in these probable cases and a little bit of an increase in lag cases, more so than we've had previous weeks. But that's because there's a few more days worth of data in there on that. But the good news, if you look at these lines up to the top of the red bar, these are the numbers broken out by race. These are African-American, whites, other race, and unknown race. And you can see we still have this big problem with way too many cases of unknown race. So if you compare from the top of the red line to the top of the red line, we can see the numbers actually went down a little bit, both in the county and in the city of Flint this week. We think that's a positive signal, but we just need a couple more weeks to really look. So I would not, just tell people, take that with a little bit of caution. Looks like things are moving in the right direction. You cannot talk about trends with a 1 week change. So we will be looking a little bit more carefully in the coming weeks to see if in fact we do have a downward trend in the COVID numbers. Yvonne, did that make sense? If you said it made sense, it makes sense. If it didn't,
I'm gonna ask you. You know me, don't you? So let's talk a little bit about the trend, because when you start talking a little bit downward, it's still a little bit fuzzy in there.
Uh-oh, did I lose you?
Did you lose me?
Oh, no, I can hear you.
Okay.
Yeah, sorry, I saw that note at the bottom of the slide. So when I say trend, right, I'm an epidemiologist. We don't call things trends with just 2 time points. I mean, like the minimum standard is you would need at least 4 time points.
And that's to help us understand where things are going, right?
Exactly. Because can you see, if you look at this, we just provide this in the brief for a 5-week period. If somebody needed to see it for longer, we could show you that because we've got the data and we've, kind of kept that stuff in the background. But look in Genesee County, for example, the bar chart on the left, you see how there in week 94, it's just over 2,000 total, right? If you include all the cases, the lag cases and the probable cases. And then the following week, it's a little bit below that 2,000 bar. That's a slight decrease. We would call that a slight decrease. But if somebody asked me to describe the trend over the last 4 weeks, I would say it was increasing, even though we got that 1 week where there's a little bit of a blip down, right? The line sort of goes, if you were to connect the dot from week 94 to week 97, the trend is like this.
Yeah. So
right?
Yeah. Kind of
So
looking at where things are going.
Yeah. And you need more than 1 time point to be able to do that. So like I said, we got it decrease for this week. So let's see if we can do our part, and nothing new happened with this virus. This virus is a trip. People ask me all the time about the original SARS, which is now the senior. So it's gotten the one added to it, SARS-CoV-1. And it just sort of petered out on its own. It was very different from this one, though. With that one, everybody who got sick within 2 to 3 days, and they all had symptoms. So it was real easy to identify cases and isolate them and bring it under control. And the virus petered out in the course of 2 years. We never had a vaccine for that. This virus looks very, very different. It loves us. This virus is a human-loving virus. And it seems to do really good at going from person to person and mutating in ways that give it longevity. So again, we are learning a lot in real time. Best thing we can do is continue to practice prevention. And the thing I didn't get to say in the roundtable that I'd like to say now is the symptoms. We have a lot of testing available. Mary Catherine will tell you about a new law. Your insurance company has to reimburse you for up to 8 COVID tests a month. The federal government has made every household eligible for not up to 4. All households will get 4 COVID tests, which, as an equity person, I was like, I thought it's better than nothing, but it's not equitable. It's not equitable. If you got a household of 5 versus a household of 2, the impact of 4 tests are very different, but whatever. They're going to, everybody household will get 4 from the feds, and your insurance company will have to reimburse you for up to 8 a month. So we have a fair amount of testing available. A lot of what the symptoms that people used to think of with COVID, the fever, the chills, the body aches, that's what we talked about early on. When it got to the US, that's when we started talking about the loss of taste and smell. That was not something that we talked about when this originally came from overseas. And then we realized a lot of people were losing taste and smell. A lot of people now that are contracting COVID are not losing taste and smell. They're reporting symptoms like a sore throat or fatigue when they exert themselves, or a headache. So I'm just, encouraging people, really be listening to your body, because any of these things could be signs and symptoms of COVID. And go ahead and take that test. Take that test. Even if you're vaccinated, take that test, because once you know, then you can keep yourself away from others and avoid infecting anybody else. But the symptoms are the thing that I think we got to keep reminding people. It might be something that you might not readily identify as COVID. So if you're just feeling off, take a COVID test.
Yeah.
Yeah.
That's really important, Dr. Deborah, because we just don't know, and it is so different. We're still learning it. And I was just kind of checking in the Q&A. One of the questions about COVID, and it's such a difficult thing to understand. So we just want to encourage you to know that we're still learning. There's still so much we can learn. When we talk about some of the older viruses and the older pandemics, we learned after 4 years. Look at the Spanish flu as an example, 1914 to 1918, 4 years of that, and we're still learning. So we don't want anyone to be discouraged. Continue to ask these questions, and we have to give ourselves a little bit of grace to say we don't know it all.
Yeah. Yeah. And that's hard for human beings sometimes, to say we don't know it all, because we like answers. People want exact answers and a clear path forward. And the best thing that we have right now, our clear path forward, is for people to get vaccinated, get boosted, and use your basic prevention protocols. And I always tell people, with the mask, think fit and filtration. I don't like the term tightly fitted or tight fitted, because I feel like that could turn people off. So I always say a well-fitted mask. What does well-fitted mean? It fits flush up against your face and your nose and around your chin, right? So tight-fitted or well-fitted mask, and a mask that has multiple layers of filtration. And it looks like they're saying 3 layers of filtration is optimal. 3 layers of filtration. So that's why the N95s and the KN95s, which they weren't designed for children. So like Dr. Reynolds said, for people like us with big heads or big faces, we're good to go. A little person might not have that same experience of wearing a KN95 mask, but you can wear your surgical mask, and you can layer that with a cloth mask if that's what you have. But the key is multiple layers of filtration and good fit.
Right. Just one other quick minute with you, Dr. Deborah. I guess I'm sensitive to this question that's in the queue, and it's a really involved question. But here's the thing. many of our young people, they don't know a lot about pandemics, HIV, AIDS, some of them were young. And so the question is should we expect COVID to be a part of our human experience now, much like HIV, TB, Hep C, B, and A, and all the things that take prolific measures to address?
Oh, she means prophylactic, which is a fancy way. The prophylactic is a fancy way of saying prevention. Like Dr. Wolford just taught us adiposity as a fancy way to say fat cells or fat. And so the short answer to that is yes, but no, Lizzie, not a problem. You asked some of the best questions. But one of the things about this is we don't know how this virus is going to move. So remember the pandemic of the 1918, right?
Yeah.
That one ultimately kind of petered itself out too. It didn't exactly all go away. It just petered out, but it wreaked havoc for 4 years. And we didn't have a vaccine then either. The SARS-CoV-1 pandemic that was like from 2000, well, really epidemic. I don't think it ever got actually labeled a pandemic. I think we only had about 30 cases in the US and no reported deaths. And we also only had about 8,000 cases globally and about 800 deaths from that. That again had a much higher death rate. It had a 10% death rate, but it was easier to manage. Why? Because again, all the people who got it had symptoms and easy to recognize symptoms within 2 to 3 days of exposure. So yeah, and it doesn't mean that this one can't peter out. The real heartbreak is that we've got so many people who've been infected and recovered, and they have some protection from that. We do have a safe and effective, vaccine at preventing severe infection and severe illness and, to a lesser degree infection, but definitely from preventing severe illness and infection. So we've got so many more tools than we had in 2002 and 2004 for the first SARS outbreak than we had in 1918. Yet we don't seem to be doing much better. And it's because we won't use the tools. It's like having a computer and not using it, needing to build a house and you've got a hammer, but you won't pick the hammer up. The tools are only as good as you pick them up and use them. I did a session around school safety and all these parents were like, well, what can we do? The schools are open, the classrooms have too many people in it. Like, what can we do to protect our children? And I said, get them vaccinated. Send them with a mask every day. Play a game. Write up their initial on the inside of their mask and say, if you can keep your mask on all day and come on with the same mask you came to school in, you get a treat. But get them vaccinated and do really cool things that encourage them to keep their prevention going. Make fun time at night and show them again how to wash their hands. My mother never taught me how to wash my hands. She told me to wash my hands, but no one ever said to me, take 30 seconds, do this, do your thumbs, get the backs. No one ever taught me. I literally learned that recently during this pandemic and found out that I had not been adequately washing my hands. So that's what you can do, parents, for your kids.
And we're still learning, but we want everybody to just, if you don't know and you're not sure, this is an opportunity to ask questions. So we appreciate those of you that put your questions in the Q&A because it helps us have these really robust conversations. Thank you, Dr. Deb. We need to hear more from the policy brief. Mary Catherine, where are you? Oh, yes, thank you. Free COVID tests. This is available for everybody. And Dr. Deborah, you mentioned that. Mary Catherine, are you going to elaborate a little bit on this one?
Yeah, I can definitely talk about this one. So earlier this week, a website was launched so that every family is eligible to get up to 4 totally free rapid antigen tests and the website is covidtest.gov. I do believe I saw Kaylee put that in the chat. And so this is just part of the federal government's effort to curb the spike of Omicron that we know is burdening hospital systems and schools. So there's so much great information on the website. If you aren't able to go on the website to get it ordered, which is super easy, a hotline is going to be made available soon for those without Wi-Fi or internet access or a computer. But you can do do this from your smartphone. You can do it anyway, as long as you have some access to internet.
Thank you.
Yeah, absolutely. And then we will be including in this week's brief, just as a reminder to everybody, the available COVID vaccines, and then just a recap of the recommended ages for each vaccine, in addition to the primary series, which is your first and second doses of shots and how many weeks apart each one is given from the first dose. And then also we included the information about when people, and based on their age, are eligible to go ahead and go get their booster dose. It can be, people sometimes you hear, well, if you're boosted, does it mean you're fully vaccinated? Fully vaccinated still is just the first 2 doses. So you can get it 2 weeks after the second dose for each, for both Pfizer and Moderna. But of course, we still want you to go get boosted as well. Okay, and then you can just go ahead and skip right to policy. Okay, perfect. So Dr. Verholten kind of mentioned, or she did mention that that new federal policy that private insurance companies are required to cover 8 at-home antigen tests per month, and that's actually per member of a household. And this is really awesome because it's going to expand tests for so many people. We know that these can be really cost prohibitive when you might need to use them 1 or 2 times a week. That really adds up. So this would allow people to be covered under their insurance to even take about 2 tests a week per month, which is really exciting. So people with private insurance companies or private insurers, so employee sponsored insurance, or even their plans from if they purchase through the marketplace, are going to be able to get free tests at their insurer's preferred pharmacy at no cost to them. Or they will be able to be reimbursed. And I just want to point out, this doesn't actually change the fact that any test administered or ordered by a provider is still going to be fully covered by insurance. So that's not going to be affected. The next thing I just want to mention super quickly is that the House of Representatives has announced a bipartisan school safety task force. And this is really number one, kind of in the wake of the November shooting that happened at Oxford High School, but it's also in recognition of COVID's impact on the mental health of children in our youth in schools. So this is an 8-member bipartisan task force, which and anytime we're working across the aisle, I always get excited about. And so what they're going to do is work to assess the mental health needs of students in Michigan, and study policy solutions and put those forth in the legislature to prevent violence in schools and also improve safety protocols. And so they're going to be relying on the expertise of, different summits of school nurses, psychologists, and counselors to prepare recommendations to aid the task force in this work. So those are the 2 pieces for this week.
Appreciate that update. Appreciate that update. Quickly, let's hear from Kiana from the city of Flint. I know you had a couple of quick updates for us, Kiana, as we round out our session today.
Hello, good afternoon, everybody. And I'm generally coming to you from my office, but we have here in the back of City Hall testing going on in partnership with the Genesee Community Health Center. And so my first update is today from 1 o'clock until 3 o'clock in the back lot at City Hall, that's near the Dome, just off of 7th Street. We are doing COVID testing and vaccinations here. Again, 1 to 3, we're at the back of City Hall, and you'll see the giant mobile unit from the GCHC, and you'll know that you are there. So if you know someone or you yourself need to go ahead and get tested, feel free to come over, and we're here until 3 o'clock. Just one other update. I wanted to just make the community aware that the recast is accepting RFPs, requests for proposals, for 12 grants. And those dollars are up to $25,000. If you visit flintrecast.org All of the details are there for community organizations to apply for those resource grants, and all of the details on the qualifiers. So please go ahead and check that website out at flintrecast.org. And there are up to 12 grants there for $25,000.
Thank you so much, Kiana. And you have rounded us out for today. We thank you so much, and we appreciate all of you for joining us today. Community health workers and for our social workers, please be sure you're in the Zoom when you request your contact hours. You must be a part, join us through the Zoom. We want to remind you to like us on Facebook. We're really trying to make sure we get this information out to everyone. So please like us on Facebook, subscribe to our YouTube channel. And if you have questions, email us at info@hfrcc.org. Call us at 810-835-2130. And again, we're glad you joined us today. And we will be back here next week for week 98. Get those questions in, and we'll be happy to answer them for you on the Healthy Flint Research Coordinating Center's Flint Community Webinar on coronavirus. Thank you and have a wonderful week.